Okay, I'm going to show you bridges with a posterior pelvic tilt first. So what you're going to do is you're going to first engage the core. So really think about especially lower abdominals, tightening and drawing those two hip bones together and making sure that it feels pretty firm and flat. And then the second thing you're going to add is you're going to actually add a little bit of a posterior pelvic tilt. You want to make sure that it's not coming because you're trying to use your legs. As best as possible, get that feeling of adding a little bit of like a little like lower body crunch, okay? Or like a reverse crunch if you want to think about it that way. But you want to feel that the abdominal muscle is what's pulling you into that posterior pelvic tilt to flatten that low back onto the floor. So we have first abdominal brace, second adding in the posterior pelvic tilt, and now you're ready for the actual hip thrust or the bridge, squeezing the glutes, driving the feet down into the ground to get that push and lift. Make sure you're breathing, and you're going to hold that posterior pelvic tilt and that abdominal brace even as you're coming back down, okay? So for some of you who may need to have the upper abdominals underneath the rib cage activated a little bit, I may actually ask for you to not just add the brace and then the posterior pelvic tilt, but you may even be asked to add a little bit of a reach. And you want that reach to come from the shoulder blade, okay? And then same thing, you're going to bridge up, exhale on the way up, holding the reach and the posterior pelvic tilt even as you come down, okay? Make sure when you reach, we're still maintaining that length between the head and the shoulders. You don't want to reach and have those shoulders pop up at any point during any of your exercises, okay? So that's going to be our bridge with the posterior pelvic tilt and potentially an optional reach with that serratus, depending on what you're instructed to do.